In the beginning there was dirt, and into the dirt fell a seed called NCCHC, and I was there to watch it sprout.
Their vision for correctional health care, back when they just sat around a dining room table in somebody's apartment and started drafting out the initial accreditation standards.
The commission started as a part of the AMA with the standards. From that, we developed our accreditation, our certification, and our education, as well as our publications.
Before NCCHC, there really weren't any accepted national standards, not to my knowledge. I'm sure there were some things going on. But NCCHC really put at the national stage, or the national level, that there should be some awareness of and compliance with standards.
I think fostering a community of health professionals and standards of care is important, and that's the biggest thing that NCCHC has done. The other part of that is that people who work in the field, professionals who work in the field and then work in our correctional institutions, have a resource when they want to talk about the level of care that should be delivered.
That has been my mentor, the commission and the standards, and learning what healthcare is all about and what are the best practices throughout my career.
It wasn't for Ed Harrison, Scott Chavez, Jay Anno, not to mention our current folks, Tom and Brent, those things wouldn't have happened.
They even had the vision at AMA to see this need to be done, and that she and Bernie took that on and worked very hard at it with very little help for a very long time.
You know when you have those special moments in life when you meet people who have that intellect and that vision to see something bigger than where we're at now and project it in the future where we need to be.
When I took my first job, my first real job, I rolled in and I was in Rhode Island in their juvenile correctional system, and I knew nothing about standards. I knew nothing about policies and procedures. Probably within the first week or two, I was asked to assess kids and take them off suicide watch or put them on suicide watch, and so the standards were really like gold to show me this is how you do it, this is the rationale behind it, and if you want more information, this is where you go look. So it was like everything I always wanted was there in the standards. It was very helpful.
Back when I started working in there was kind of a stigma about working in corrections. You know, you were either on your way out, you were an on-the-job retiree because you closed down your practice, or you couldn't get a job anywhere else.
And it was easy to get a job in a jail in those days. They were begging for people.
The most important change that I've seen in correctional health care in the last 15 or so years since I've been involved is a wonderful evolution towards people getting involved in correctional health care as professionals by choice early in their career.
The workforce that we have now is just unbelievable. Now, I'm kind of biased because I usually go into a facility that's accredited by NCCHC, but you see everybody with their certifications, they can communicate, people have multiple languages, there's different ways of communicating with people who don't speak your language. Those are all in place now. It's a kind of a proud place to work in.
Some of the changes that I've seen is the advocacy. So when I first started in corrections, it was more punishment-based. You didn't see a lot of the health care that we're seeing today, where now we're becoming the advocates for our patients. We're making sure that they're being seen for their substance use disorder, their mental health care.
I think what's happened is I think people are more sensitive now to people who are incarcerated. And we didn't see that sensitivity. Even in 2000, we didn't see that sensitivity.
I really believe that the Commission has made a tremendous difference. I know it has.
Everything that has changed has been for the better for us.
I think I have been at every conference since 1994.
This is my first conference.
Every conference. I've never missed a conference in the 15 years I've been on the board.
I think the value of coming into the educational conferences is that you get to interact with other people working in your field.
Oh, the networking.
Networking. There's knowledge that you can gain from attending the sessions, but it's nice to talk to people across the country.
When it comes to conferences, to be perfectly honest, it is like the best networking opportunity that people within our organization can receive.
And it has such a sense of camaraderie, mutual support. It really reinvigorates you. You go back to work feeling like, yeah, I knew I was doing this for a reason, and now I feel extra committed to it.
And after having my first conference, I was really interested in finding out more because I realized there's a whole bunch of people out there that know more than me.
Coming to these meetings just really kind of spurred me on. When I'd get to that point where I thought, I can't do this one more day, you know, I could come to these meetings and meet people who were in the same boat.
Coming to a conference and having the realization that for the first time I was with people who are doing exactly what I was doing. And it was like coming home or finding a home for the first time.
I found that there were other people like me. I came to the NCCHC conference and there were all these other people who were thinking important things about correctional health care. And I read Jay Anno's book on healthcare delivery of an adequate system, and I read the NCCHC standards, and I said, oh my goodness gracious, these people have written down all these important things that I was thinking of, and they did it far better than I could ever do.
For me, the most important part of coming to the conferences after all these years now is the people that I meet and the things that I can learn from them and the things that they're doing in their facilities.
I will come close to quoting a mentor of mine from when before I joined the commission, and he said to me, that organization, NCCHC, is single-handedly responsible for bringing correctional health care out of the dark ages.
It's been a great ride.